The point being that this is exactly the kind of thing that looks like potentially a small change in the workflow, right? Where let's not open everything in advance, as an example, that could result in tens or hundreds of thousands of dollars of prevention and waste.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
This week on Power Supply, we speak with Lana Makhanik, COO at VueMed in Hays. This, I think, is the first time a listener has listened to the episodes, reached out, and said, hey, I've got a good topic for you all. I want to talk about, in this case, Lana told us, KPIs, key performance indicators, and then how to build competencies around that. So she and I spoke for a few minutes in preparing for the interview, and definitely a topic I think that the audience is going to enjoy. And she's got a great amount of detail, and she's going to tie it all together into a much bigger picture for the state of healthcare and just how much more sophisticated healthcare organizations need to be as we continue to move forward under different reimbursement models and understand patient outcomes and how it relates to patient experience.
Totally agree, Justin. I've known Lana a long time, and she is really, really good at this and a good expert. She explains it well. So come on and listen. I think you're totally going to learn a lot, and I'm glad she's on with us today.
All right, we're going to be right back with Lana Makhanik, COO at VueMed.
I'm Hays Waldrop.
This is Garry Skinner.
And I'm Justin Poulin.
A production of 17 Studios. You're listening to Power Supply.
Joining us now is Lana Makhanik, COO at VueMed, and we're going to be talking about key performance indicators and specifically competency around establishing them, utilizing them, and tracking them. So Lana, thank you so much, not only for coming on this episode of Power Supply, but for you and your team reaching out to us and seeing if this might be a topic that we'd want to cover, because the answer was a resounding yes. So welcome to the show.
Thanks so much, Justin. I appreciate it. Thanks for having me.
So Lana, why don't we start by having you tell everybody a little bit about your background and also, how you really came to love KPIs and really, just spend so much of your work on them.
Thanks for asking, Justin. So my career actually started in management consulting years ago. And part of the work that I have done in that capacity was actually working with medical device industry. And supply chain issues came up as one of those core issues that needed to be solved effectively, both in terms of clinical evaluation of how devices and supplies performed for physicians in the marketplace and during the patient care process, but also what was happening on the operational side. Did they know what they had on the shelves? How did they know that things were safe to use? And various, effectively, supply chain issues. In fact, I'll give you a story of working for J&J at the time when those folks have been in healthcare supply chain for a while will know this, when first drug-eluting stent was being developed, before it actually was approved on the marketplace. We worked with J&J, and some of our work included the supply chain issues, and we sort of saw what was going to happen with some of the things on the supply chain side when they were introducing that product. When that product was first introduced in the marketplace with a massive amount of shortages because it was a huge demand for it. It was a breakthrough innovation. A good example of sort of disruptions in supply chain that I think was initially encountered. And unfortunately, the organization didn't respond very well to those disruptions and the shortages. And so when the next competitor came to market, a lot of people switched, right? It was like, that's it. We're done. So let's try to address this issue differently. But that's just a little bit about my background and one example of that. In the course of that type of consulting work with medical device companies and speaking with a lot of provider organizations in terms of the issues they were facing, we learned a great deal about the supply chain related problems that were faced by each individual clinical organizations within hospitals, right? As well as obviously the supply chain manufacturers. So we found ourselves in a unique position to be able to say, look, both parties, in fact, all parties in the healthcare supply chain, including the end users, need visibility, need transparency, need trackability, need a way to understand what's happening with those devices and supplies. And so that's actually one of the reasons the primary reason we created VueMed. We started the company is to solve that problem. Led us down multiple pathways, obviously, but that's the key parts of my background and kind of what led me to this point.
And Lana, that actually leads me to this question. You and I have talked through the years. How long have you guys been around? Number one. Number two, kind of what does your ideal customer look like? Just kind of give me a feel for that.
Yeah, absolutely. So we started working on our software and our product back in 2005, 2006. We officially incorporated in 2008. And so we work primarily with hospital provider organizations. So typically larger institutions, academic medical centers, IDNs, those who have substantial procedural volumes, effectively do a lot of cases in places like the ORs, the cath labs, the interventional radiology areas, the types of places and organizations that obviously utilize a lot of devices and supplies, and where devices and supplies are kind of an essential component of patient care process, right? Without these devices, they're often life-saving, right? We know that. So without them, the clinical care protocol, clinical care pathway wouldn't even exist, right? So they're an essential part of the care process. But as we talked about earlier, operationally speaking, they have not been dealt with in the same vein, right? Like, how do we bring them in? How do we track them? Do we know for sure they were part of this particular patient procedure? Those are the pieces we had not really solved as an industry yet, right? We've done really well in the clinical technology part. Now we need to solve the clinical operations part when it comes to these devices and supplies.
We've had so many conversations on this show around that, and even talking about where's the line between the clinician and, materials management and supply chain and strategic sourcing. We've had conversations about how to go end to end and really tie all of that together, including how do you get revenue cycle involved in the conversation so that that's integrated, a lot of the silo piece. But I think one of the things you addressed early in this, kind of really while you were talking about your background was really being able to create effective pathways between the supplier and the healthcare provider, right? Both sides of the table seems to be the common phrasing we're all using lately to describe that dynamic. But now you almost have a lot more of third party coming in, right? Like there's third party logistics, there's, interoperable platforms that try to connect these dots and start breaking down the silo between provider and vendor. And I can't even tell you, having been an education chair of our local ARM chapter in Philadelphia for so many years up until the pandemic, that a lot of our conversations were about how do we collaborate better? How do we have vendors and providers partnering? And I think a lot of it does come down to that transparency piece that you were talking about, but ultimately it leads us to the conversation for today around key performance indicators, because you could have two well-intentioned organizations, vendor and provider, completely well-intentioned, trying to work together. But if they're not focused on the right information, they still end up getting in each other's way, not really being responsible to both organizations' purpose, right? And their ability to thrive as a business. So, I think a lot of this really starts with measuring the right things and making sure that that data is available, but you really can't until you know what you want to measure. So let's start at the beginning. When you're working with providers, and I'm assuming vendors alike, you've got to figure out how you're going to measure and what you're even capable of measuring. So as you're establishing that measuring system, how do you go through that process so that you don't have all this downstream impact and then you realize that you're not even measuring the right things after you did all this work?
Right. That's a very good question. So let me back up for a second and start with the fact that it's very important to not be, the best way I can put it, supply chain centric when you're talking about solving these issues. And by that, I mean, you got to start with the end in mind, right? Or the end goal in mind. What is the end goal, right? The end goal is the optimal patient care process. What does that mean? Right. That means that your provider needs what they need when they need it at the moment they need to serve that patient, that the patient's going to walk out of there having their needs served. Right. That's our goal. Right. Supply chain is a huge component of that goal. Right. But that's not the only one. It's just one major one. All right. So if we think about it from sort of the clinically centric approach, patient centric, caregiver centric approach, let's step back and say, okay, how do we translate that into the operational measures that are relevant to supply chain to be able to meet that goal ultimately, right? So as an example, if you just focus on supply chain, right, you might think about terms like inventory turns or fill rates, those sort of the typical supply chain metrics. And while those are very relevant if you're managing a warehouse, if you're managing a particular supplier relationship, right? Because those are very salient to the specific things you need to deliver in that particular environment. Those are not necessarily salient metrics when it comes to managing clinical inventories in a place like the OR or a cath lab. Okay. So because you have to look at things in a much greater context. Because as you were saying earlier, right, it's a complex context. They're dealing with multiple systems, multiple different kinds of patients. They have multiple pressure points and what they have to deliver. They're dealing with clinical systems, administrative systems. They're dealing with revenue cycle issues, billing issues, all of that. So all of these things need to come together because at the end of the day, it doesn't matter, for example, that from a supply chain perspective, you got the best possible price for widget A if widget A ended up sitting on the shelves for 12 months and expiring, or widget A ended up sitting on 12 months and being recalled, or let's say widget A continues to be used, but guess what? It got missed in billing 50% of the time. So those are the kinds of things you need to kind of look at holistically, right? In fact, as you guys know, HIMSS organization, right, now has a clinically integrated supply chain focus or track. And because they understand that this is a huge component of the patient care process, a huge component of the cost the organization incurs, and a huge component of patient safety assurance mechanisms that have to be put in place as well, right? Because millions of these devices floating around, they're subject to recalls. And if we don't know which things went to which patient, we're kind of in trouble, right? That's kind of the basic piece of it. But going back to the measurement system, back to what you were asking about, right? How do we look at it? So we look at it holistically, right? We look at it from the end goal in mind, and we say, how do we translate that into the operational measures for supply chain? So if you want to talk about some examples, that one of our favorite metrics is, it's actually a compilation sort of KPI that we do, which is we say, hey, what has been your volume of cases for the last, let's say, 12 months, right? And what have we seen in terms of how much is being purchased versus how much is being used in terms of your supplies and devices in that same period of time, right? And then we say, okay, well, how has it impacted your inventory levels in the same time period? So what you're often seeing is, okay, if your purchases and consumption is really nicely aligned, and regardless of what your volume is doing of cases, then frankly, what you have on inventory, as in here's my total inventory on hand, the inventory is just a reflection, right, of your volume, of your purchases and your consumption at the end of the day, right? Supply chain might only look at inventory in isolation.
Right.
Like what hasn't changed from last month or 3 months ago, whatever, right? And therefore, then try to justify, why has it increased, right? Like what's happening. And they won't necessarily know because they're not measuring everything else.
Not only will they not know, you're speaking to, they'll understand it retrospectively instead of being able to anticipate what the trending is like. Like they're relying on people to tell them we added X number of surgeons and we're expecting this spike in volume. But when you go by that, you're not really adjusting inventory proactively, because people, anytime you recruit somebody to come and do a new procedure or increase volume of a profitable procedure, it doesn't mean that they actually meet the targets or the goals. So you ramp up all of this inventory, and then how quickly are you adjusting, and are you watching that trending so that you're not reacting to the situation later, either with dead stock sitting on the shelves or not having enough to meet the need because, oh, guess what? We projected this, but we were able to ramp up on these procedures. We didn't realize how in high demand they were. And the next thing, and everybody's like, this is great. And this is profitable. So they just keep scheduling. And then it turns out that you don't have enough. And then you're canceling while you're also booking out that block scheduling. And then that's a whole other issue. And I think what you're talking about is really not measuring in a silo, but gaining alignment with all of these different projections and measurements. So what would you call that when you're aligning the measurements that are maybe more common for supply chain? And even if we just wanted to say materials in this case, right? Like when you're trying to align, this is the strategy part. This is where we start to move into strategic sourcing and everything else. But from the materials piece, we know what we kind of want to measure. And you mentioned a lot of those terms, but how do we get that alignment? What else should they be looking at to really pull all these pieces together to have a measurement system that is more broad?
Yeah, no, it's a good question. So right now we've focused on, again, showing the alignment, showing what we call contextual information, right? So if supply chain only cares about traditionally of the inventory values, in your example, they would have to justify, right, the increase in inventory, and their justification is going to be, well, they told us they're going to bring in a bunch of surgeons, so we ramp up, like without actually measuring all of this stuff, right? Versus in the way we sort of contextualize this is, look, inventory values or data is effectively a reflection of all the other activity that is happening. And to your point, it's the alignment that's most critical. The alignment of how much you are buying versus how much you're using, and whether that alignment is very, very close and meeting the clinical needs, given your patient population, given your volumes, right, given whoever your surgeons are and what types of patients they're dealing with. That's the alignment is what we're looking for. That is the key issue. Everything else becomes simply a reflection of that alignment, effectively, right? So if your purchases are consistently higher than your utilization, guess what's going to happen, right? You're going to have more stuff sitting around for longer without being used. You're going to have more stuff expiring, right? You're going to have more stuff. You're going to risk misalignment and composition of the right stuff versus the wrong stuff that you're using, right? This is just kind of common sense. So what's been missing in this whole sort of measurement equation is this type of contextual information and tracking throughout the organizations. And the other thing that's been missing, I would say, is the basic, I would say, really competencies around inventory management, supply management for a lot of these clinical areas, right? Because nothing I'm talking about is it's pretty common sense, right? It's pretty obvious. If you buy too much, you're going to end up with wasting stuff, right? But how do you get to a point where you buy the right stuff, all right, at the right time so that you don't waste it, all right? And then so that it supports your clinical operations properly. So this is the alignment is one of the key indicators that we'll look at. The other secondary measures, again, which is also a reflection ultimately of this alignment and additional opportunities, are things like how much are you wasting, right? Your expiration rates, your unused inventory rates, your opportunities for realigning or adjusting your par levels, sort of min-max levels that are more reflective of the actual utilization trends. Because remember, this is highly dynamic clinical environments we're talking about. Utilization trends are going to change, right? To your example earlier, they'll bring additional surgeon or practitioner who may have slightly different patterns, who may have slightly different patient populations, right? They may be new technologies that are coming into play, and as they do very frequently. So it's very important to keep track of that stuff on a regular basis. This is why, again, you go back to alignment. You got to keep the alignment in perspective at all times. And then you also keep track of, well, how much are you wasting? How much of unused inventory you might have around? Your par levels, your inventory levels, your composition is still aligned with those utilization needs that you're seeing. And that allows you to then be not only to look at it retroactively in terms of trends, but then to ultimately be proactive in forecasting your needs based on what you expect your patient populations to be, what you expect your procedures to be, what you expect, therefore, your utilization to be.
So what are some best practices for developing these key performance indicators in this case? Because I think you did a really nice job of kind of telling us, here's where the gaps are, from this more traditional approach. But the whole conversation around getting that measurement system in place and sort of identifying the opportunity, well, now we've got to rebuild this, right? It's almost like the $6 million man. We'll make them faster. We'll make them stronger. That's really what we're trying to do, is build resiliency into the supply chain. And especially right now, because our resiliency was tested. And, I think a lot of us felt like in many areas we did not pass the test. Others we did. And probably where we passed the test is our ability to pull together as, team members. I think clinicians and supply chain got a much better understanding of each other during this test and maybe got an appreciation of each other's perspective. But prior to that, the silo piece and everything else, this was a big gap for organizations. And now we know. So now that we know, and both sides of that equation internal to the organization, there's the vendor component too still. But now that we know that, how do we build these key performance indicators so that we are more resilient moving forward?
I would say the key to that, to building part, is collaboration. If there's one word I would use, it would be collaboration. Perhaps partnership is another really good word. And by that, I mean collaboration and partnership with all of your internal stakeholders. That means clinical leadership, supply chain, finance, IT, right? All of these components that are inevitably part of making any initiative successful that is multifaceted. And this one is certainly one of them, right? Because you do need to, it involves clinical workflows, it involves looking at data, it involves obviously supply chain processes, and it involves finance because revenue is still an important part of the equation, right? And revenue is directly impacted by how efficient the clinical workflow is, how efficient the documentation is at the point of care, how efficient our tracking and tracing capabilities for a lot of these devices and supplies for which we need to bill. Right?
Yeah, you're talking about charge capture. You're talking about managing expiring products. You're talking about all of that. And also, we just had an episode not too long ago where we talked about back orders, and back orders comes into this whole equation too, and try to piece all of these together. So, I kind of hear some best practices for KPIs. In some ways, it's almost like setting par levels in a way, right? Is just understanding where your threshold are, and what are you measuring the things that are going to let you know where you're in the yellow or now you're in the red, and do you have effective response planning when those KPIs start to enter into that yellow or red zone in a way. But then there's this whole part about now we have to build competency, right? So it's like, okay, we have the measurement system, we have the key performance indicators, but what we don't have is necessarily the competency around the KPIs. So in your approach, how do you build, those competencies and also sort of maintain that, because none of this is something you just set up and then you're like, oh, great, it's done. We're done. Everybody's good, right? There's ongoing management, and that's part of the competency piece is the maintenance aspect and the sustainability.
Yeah, no, there's no question about it. And again, back to the collaboration and partnership approach, right? It is a multi-constituent process. Like any successful initiative, it needs to have a proper oversight. It's not enough just to have the data, which is a huge critical part of the equation. Obviously, you need to have the data. It needs to be reliable. You need to put it in the context of this KPI measurement system. And then you have to have a leadership oversight. So there's accountability for it, right? And not only accountability, but also continuous efforts towards striving for additional goals, right? Because at some point you're going to want to meet your goals, and at some point you're going to need to create new goals, right? Because let's hope if to have a successful program, that means you've achieved your success. You're going to want to go to towards that next milestone. Right?
Nobody's going to let you just stop there.
Yeah, exactly. Exactly.
Because once you start telling everybody about what you did, they're going to want more.
Absolutely. And that's a good thing, right? So building the leadership oversight and accountability into this is a huge part of the equation.
What about understanding the throttle? Like, just kind of piggybacking off that last point, what about understanding the throttle? Because that whole piece about recognizing that there's a maintenance factor, it's not like we put this much time in to get here, so now we have exactly that same amount of time and resources, on the team to take it to the next level. You almost have to say a portion of that time still has to be attributed to maintaining what we built. So we can't necessarily do something as large scale as we focus on continuous improvement, right?
Well, honestly, the nice thing about continuous improvement efforts is that they don't have to be all big, right? So it's probably, it takes obviously quite a bit of effort to establish a program like this. You have a measurement system, to have protocols that people follow, to have an oversight and things like that. But once it's established, because it's a different way of doing business, right? Once these things are established, then you can say, okay, I want to, for the next 3 months, my goal is going to be X. And that X could be, I want to reduce my waste levels by, 10%. It doesn't have to be necessarily a huge amount. Or I just want to focus on this one particular measure. So to give you a good example, for example, one of the measures we focus on is, we call it consume wasted. So this is the amount of stuff that people open but not using during cases for patient care. Sometimes there's good reasons for that, because the item could be defective, right?
But you can't restock it, right?
But you can't restock it, right? Can go back and
it's
restock.
a loss.
Exactly.
It's cost loss.
But a lot of the times it's an operational and workflow issue, meaning the items are opened in advance without knowing exactly which ones are going to be used, right? So those kinds of things, because it's a physician preference, for example, well, in some cases that may be warranted. In many cases it isn't warranted, right? Because it can result in this type of waste. So the point being that this is exactly the kind of thing that looks like potentially a small change in the workflow, right? Where let's not open everything in advance, as an example, that could result in tens or hundreds of thousands of dollars of prevention and waste. Honestly, because we've looked at the numbers, and all it takes is a couple of fairly expensive items in any given week.
I really love what you just said about just kind of taking some small ones, right? Because once you have a foundation, everything else can come out of that. And if you're measuring the right things and you have the right alignment and you're looking at some essential KPIs, what you're really talking about is now we're looking at the data to say, not only the data, but also feedback from the organization and saying, okay, now that we've got this in line, like what other indicators might we be missing? And then once we start to look at those, how can we take the next step? Or is there something that we're not measuring that we can build into this framework and learn something about that? Maybe it ends up being something that we didn't need to measure and we cast it aside again. But it's all about kind of getting this like dashboard concept that helps us ask the right questions as things begin to change. But ultimately, if you're telling the story and you're getting that higher senior level involvement, this all has to fit into a much bigger picture, not only for supply chain, I'm going even higher than that. I'm going to executive leadership. I'm going to performance across an entire system. So, you might be working on, some of these KPIs and you might have them built at a facility level and they're tied into what strategic sourcing wants to do across, like a 12 plus hospital system, but it doesn't necessarily tie into the full organizational view and how the organization is performing, right? Because now you're talking about all the pieces of the puzzle. You're talking about human resources. You're talking about recruiting. You're talking about marketing out into the community. So how do we take some of these KPIs, get that alignment, build the competencies, and start to make this, slow and steady performance improvement? How do we get this to all fit into this larger picture that is a healthcare organization?
Yeah, no, it's a very good point. Yeah, it's a very good point. So I would say it's a lofty goal because in the sense that, the healthcare supply chain, right, has been oftentimes pretty siloed, as I said, within their own walls, right? Clinical folks have been kind of siloed and doing their own thing. So now what we're talking about is integrating those two things, right? Which is really important. Of course, finance is a huge part of the equation because of the charge capture issues. The next thing is, so once we're building competencies around operationalizing these, as I say, patient care processes in the context of how do we need these things to happen in most efficient and cost-effective manner, right? Supply chain being part of that equation. The next thing is going to be for the organization to figure out how do we incorporate these operational measures into the larger context of how we manage our expenses, how do we deliver our patient care to the community in general, how do we do this in the most cost-effective manner, overall.
And how do we market it, right? How do we market it to the community? Because, or how do we tie it to HCAP scores somehow? How people perceive how we're performing, or how some of these KPIs that are aligned with clinical performance end up impacting the patient experience, right? So those are some ways to kind of tie all of that together, I would think, as well.
That, and then ultimately patient outcomes. So number one thing that people want to go after really out of these measures. So how do these operational issues ultimately that we're trying to solve operational issues at the moment, right? We're trying to solve operational issues. We want to build the right context. We want to measure the right things so that ultimately the patient delivery process, so patient care delivery process is efficient, cost effective, and creates the best, not only the best outcomes, but really good patient experience, right? So if you think about that, those are the goals, right? And we're trying to work ourselves backwards first on the operational side. The next thing on this is really mapping this to patient outcomes. And I think at first, those patient outcomes should be mapped to sort of the direct procedural care, right? So if you had a heart surgery, if you had a triple bypass, for example, right? The first outcome is, well, how are you doing within 30 days of the operation, right? How are you doing within 3 months? How are you doing within 6 months? And then starting to build other clinical sort of indicators around that, and what, to the degree that supplies were part of that equation, right? Figuring out which items were used, what kind of protocols were followed, what combination of things was to produce the best possible outcome, right? Eventually it turns into the long-term type view, meaning if we followed this patient from the time they first received a diagnosis till like 10 years out,
yeah,
all of the care that was received, right? That's kind of what we're trying to do, right?
It's like evidence-based medicine, except there's two stages, right? You get evidence-based, information as you're making a decision what to use and even just, the way to do a certain type of procedure, not just the products that you're using or the vendors you're partnering with, but, technique and, best practices around that procedure. And so I totally hear what you're saying is all that kind of contributes to outcomes. So it's like we have this, sort of like evidence-based study or information or data that's provided before we get started. And that's why as a healthcare organization, we make those choices. But then we have to validate that the organization is getting the same results that were expected. And so again, having all of this built can help you measure against, did this did all of these things contribute to what we expected? And ultimately, right, what you want is the patients to tell everybody else in the community, I went to XYZ hospital or system and I had a great experience and I got better super fast and I would recommend them. Like, that's the future of healthcare, what everybody wants. And you did a really nice job of kind of like, I know we started, this is a very broad topic and we're kind of out of time, but like from the very beginning, we're talking about something very granular. And then we tried to go all the way to this super big picture in 30 minutes. So I appreciate you going along for the ride with us.
So if you want, one more thing I would add into this is really, so there's a patient outcome picture and then there's the financial operational picture for the organization, right? And I think one of the issues within health systems is that we focus on those two things completely independently from each other traditionally. Right. We've looked at the patient's care side. We invested a lot in clinical technology, right? Because we get paid for that, all of that good stuff. Now we worry about things like patient experience because of HCAHPS scores. We worry about, readmissions because of, hospitals getting for that. People are beginning to look at obviously community involvement and ensuring community health and things like that, which are fantastic initiatives, right? Now what we're trying to do is bring those areas of focus back to what does it mean to operationalize this? How do we do this in the most cost-effective, efficient, and financially sound manner, right? That allows us to be good financial stewards of our available resources. And those resources, as we know, can be totally strained at times. Then how do we put contingencies in place to be able to manipulate our resources when there are things like pandemics we have to address, right?
And that goes back to that whole resiliency piece.
Exactly. So in order to do all of these things, you need to have good data. You need to have good, measurement systems in place. So you know what you're going for. You know what you're playing with, if you will. So you can, buy less of this and more of that, or you can stop seeing this type of patient because they can afford to wait versus you cannot, those types of patients because they cannot, right? Those are sorts of things that as we get more data across the board for both what it takes to deliver care as well as what outcomes it produces, right? As we put that information together, that's what is going to enable us to have, good healthcare system ultimately.
Yeah. Lana, really, really nice job today. Thank you again, not only for coming on and sharing your expertise, but also, as I said at the very beginning, thanks for reaching out because you were a listener before you were a guest. And I really appreciate that. Thank you very much for listening to prior shows, but then contributing to the education of the industry by joining us today.
Absolutely. Thank you for having me. I appreciate it. And Hays, did you want to ask something else?
I learned a lot. I'm sitting here like going, wow, I'm impressed. No, but thank you so much. Seriously. I mean, I have followed your career for the last, 6-7 years, and you did a great job today. So thanks for joining us.
Thank you so much, you guys. I really appreciate it.
That was Lana Makhanik, COO at VueMed, and we're talking about building key performance indicators and developing competencies around that. And Hays, we really took her down a long and windy road, starting at a very granular level, talking about just setting up the measurements that are ultimately going to get aligned with the goals of the organization or the service, and then starting to take a look at that, build these KPIs, and then competencies around that, and making continuous improvements along the way, and ultimately adjusting not only to new reimbursement models. I mean, I say new, but accountable care has been around for a while. But at the very end, we were talking to Lana about how that really does tie into the patient experience and patient outcomes, and getting all of that into focus these days, especially with all the pressure that we've had over the last it's going to be 2 years before you know it, Hays. Over the last 2 years, it was a daunting adjustment, I think, for healthcare to begin with. But getting this curveball has made it really even more of a struggle, I think, in a lot of cases. And so I like how we started small and went to the big picture along the way.
Absolutely, Justin. I have to say, I mean, she obviously is an expert, clearly, and been doing this for many years, but talked about the clinical, financial, operational importance of KPIs. So I thought she did a great job. I loved it. So thanks. I'm so glad she came on.
All right, well, that's going to do it for this week's show. As a reminder, you can support Power Supply by subscribing on Apple, Amazon, or Google Podcasts, Stitcher, iHeartRadio, Spotify, or on your favorite podcast application. We've also got bonus content for certain episodes. You just got to download our smartphone app for iPhone and Android. We'd certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Hays and myself, thank you for listening to this week's episode of Power Supply.